Good afternoon, New Brunswick, and welcome to today's COVID-19 update for the province with Dr. Russell and Minister Shephard. We should be starting in just a couple minutes. We've just done the roll call with the journalists. I'm Vicki Hogarth at the CHCO News Desk. We'll start off just by doing a quick recap of yesterday's numbers before we find out the new case count today from Dr. Russell at the start of the conference. Yesterday, there were 9 new cases of COVID-19 in New Brunswick. One of those cases was in Zone 1, that's the Moncton region. Another case was in Zone 3, that's the Fredericton region. Another case was in Zone 6, that's the Bathurst region. And then the other remaining 6 cases were in Zone 4, that's the Edmundston region. In total, right now, there are 158 active cases of COVID-19 in New Brunswick. And in terms of the breakdown, where those are in terms of our health zones, 17 of those cases are in Zone 1, 11 are in Zone 2, 9 are in Zone 3, 119 are in Zone 4, and that's the health zone, obviously, that's still in lockdown for at least until Thursday. We'll get an update later this week from Dr. Russell about whether or not lockdown will continue for Zone 4. 0 cases in Zone 5, 2 cases in Zone 6, and 0 in Zone 7. Now, we will be finding out, as I mentioned, the new case count from Dr. Russell at the very start of the conference, along with other information today. I'm not sure what that information is at this point. I do know that there will be a visual today. I have that visual. In the past, you've wondered if we've had the visual or not from Bruce and from the Office of Public Health, and we do have that visual. So when Dr. Russell speaks of it, it's a graph. We do have it today to share with you. In terms of other updates, if you are watching this from the Charlotte County, Southwest New Brunswick region, testing obviously has been opened up to anyone who's been in a place of possible exposure. And I did mention last week there were some in the St. Stephen, Campobello area that are posted on our website and our Facebook page. So if you do want to get tested and you live in this area and you're wondering how it works in terms of getting tested in the town or area that you live in, if you are applying to be tested online, there's a drop-down menu where you can request being tested in your own community or the closest town to you. So for instance, there is testing available in St. Stephen, I do believe Campobello as well. So if it's something you feel you should do, you were in those exposure zones on the dates that were listed that were in this area, then definitely by all means sign up to get tested. I do believe the turnaround is really fast now, about a day from when you apply to when you go to get your test. In terms of other news, there will be our vaccination update. There have been 200,000 doses of COVID-19 given out in New Brunswick already. 28% of the province has received at least 1 dose of the vaccine. So it's a significant number, and I know that number is actually higher in Zone 4, the Edmundston region, where there's obviously still an ongoing situation with the UK variant, where last I learned last week, 34% of Zone 4 had actually been given at least 1 dose of the vaccine, and that's obviously public health initiative to try to stop the spread of the UK variant in that zone. Now, as I mentioned, we should be starting momentarily. I do have a lot of questions that have come in from the public this week. They're all on cue cards in front of me. So I will be keeping those in mind when it's Charlotte County Television's turn for a question. I think we're around number 5 on the list today. And I do have about at least 8 questions in front of me that I've prioritized. It will depend again on the news that were shared in the conference from Dr. Russell and Minister Shephard. Again, if you're new to joining us, I follow as well on Facebook. If you're watching at home on TV, but you'd like to bring a question to our attention to ask to either Dr. Russell or Minister Shephard, feel free to do so on the Facebook live stream. You can either ask it openly, you can message Charlotte County Television directly on Facebook. If you don't have Facebook and you'd rather reach out by email, my email is Vicki, vicki.hogarth, Hogarth, at CHCO.TV. And I do put all the questions you send me on cue cards for consideration. Whether they get addressed by Dr. Russell or Minister Shephard in the conference, we'll decide whether or not I need to actually ask it or if I can get an answer for you privately. I try to do my best to prioritize what seems like the most pertinent question to the situation we're currently in. I know there have been different talks this week about whether or not vaccines intended for the Maritimes could be rerouted to Ontario. I don't have an update on that. I am expecting that to be addressed in today's conference. It looks like we're going to the conference room right now.
In New Brunswick. Bon après-midi tout le monde, bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shephard, ministre de la Santé. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Dr. Russell?
Thank you, Bruce. Merci, Bruce. Bon après-midi à toutes et à tous. Good afternoon, everyone. Santé publique a confirmé qu'un premier et rare cas de formation de caillots sanguins en réaction au vaccin AstraZeneca a été signalé au Nouveau-Brunswick. Cette réaction, appelée thrombocytopénie immunitaire thrombotique induite par un vaccin TITIV, est associée à de faibles taux de plaquettes. Cette personne du Nouveau-Brunswick âgée de 30 à 39 ans a reçu à la mi-mars le vaccin Covishield, soit la version du vaccin contre le COVID-19 AstraZeneca. Il ou elle a reçu le vaccin avant que le Comité consultatif national de l'immunisation recommande le 29 mars que le vaccin ne soit pas administré aux personnes de moins de 55 ans. Et cette personne a reçu des traitements appropriés pour quelqu'un qui a été identifié d'avoir reçu le vaccin, et cette personne est maintenant rétablie. Pour protéger la confidentialité de ce patient, je ne peux pas fournir d'autres détails à son égard. Public Health has confirmed the first New Brunswick case of a rare blood clot reaction to the AstraZeneca vaccine. This reaction is known as vaccine-induced immune thrombotic thrombocytopenia, VITT. It is associated with low platelets. The New Brunswicker, aged between 30 and 39 years of age, received the Covishield vaccine of the AstraZeneca COVID-19 vaccine in mid-March, and this was prior to the March 29th recommendation from the National Advisory Committee on Immunization not to provide this vaccine to persons under the age of 55. This individual has received appropriate treatment for someone having received the vaccine and has since recovered. For reasons of patient confidentiality, I cannot provide further details. Now, these reactions are extremely rare. We see them in approximately 1 in every 100,000 to 250,000 doses, but they do happen and they are treatable. There is information on our website and the Public Health Agency of Canada website. While every adverse reaction is unfortunate, it is important to keep in mind how rare these incidents are. And I would like to highlight the benefit of this vaccine and all vaccines in terms of providing protection against the much higher risks that come with COVID-19 infection and indeed blood clots as a result of COVID-19 infections. The AstraZeneca vaccine remains a good choice for people who are at risk of severe outcomes from COVID-19 and would otherwise have to wait several months to access another vaccine. And this is especially true as we see variants of concern such as the UK variant and the South African variant circulating now, which have much more aggressive symptoms and severe outcomes. We never know where and when the next surge of cases are going to appear in the province, and we must protect everyone and be prepared for those surges. We have 2,500 doses of this vaccine in our current supply, and we will make sure they are used safely and appropriately for those who have mobility issues and are not able to come to a clinic. Remaining scheduled AstraZeneca clinics for those 55 and over will continue as planned this week and next. Those 55 and over have an increased risk of complications from COVID-19, and the benefit of the vaccine outweighs these risks. We will continue to monitor the effects of all vaccines and ensure they are used properly based on current expert advice. La ville d'Edmundston et le secteur d'avoisinant est en confinement depuis 10 jours. Cette situation est difficile pour les citoyens de la région de Madawaska et constitue une source de stress additionnel dans leur vie de tous les jours. Je tiens à remercier toutes les personnes de la région d'Edmundston qui suivent les conseils et les directives de santé publique. Your determination and dedication are helping to prevent illness and save lives. We have seen cases where people have not immediately sought a COVID-19 test when symptoms emerged, and so we do need people to continue to get tested for COVID-19. This is very, very important. Il y a trop de gens qui ne limitent pas leur contact étroit aux membres de leur bulle d'un seul ménage. Il y a trop de gens qui ne s'isolent pas convenablement des autres après avoir reçu la directive de la faire par santé publique. Ça peut arriver n'importe où dans la province et on voit ça aussi avec les gens qui voyagent. These actions do have consequences when we're not self-isolating properly. And definitely, we really need to have everybody's cooperation to get outbreaks under control, including the one in Edmundston and future outbreaks as well. We don't want to see more infections and more illness and more hospitalizations. So we're going to show a slide right now, and what this slide shows is that the outbreak, in terms of the course of the outbreak in Zone 4 from March 22nd until today. So the first dark bar is showing March 25th, when Public Health put a circuit breaker in place by moving the area to the red alert level. And the second dark bar is on April 10th, when the lockdown was declared in the Edmundston area. And this graphic shows that despite all of our efforts and all of your efforts, the case numbers are remaining stubbornly consistent in that area. So they have come down slightly, but they're still staying at a steady state, and that's not where we want to go. So there has been a modest improvement, but it's not enough. So in the first 10 days of this month, when Zone 4 was at the red alert level, the area reported an average of 7.6 new cases each day. And the 10 days since the lockdown began, the average number of new cases has declined slightly to 6 new cases per day. And the presence of the new variants of COVID-19 virus, which are more contagious and more aggressive in terms of the severity of symptoms than the original strain, is adding to the challenge that we're facing. There's no question. But if everyone in the lockdown area continues to follow public health guidance closely and consistently, then we will be in a much better position to limit the impact of this outbreak. Il y a présentement 100 cas actifs de COVID-19 dans la zone 4. La grande majorité se trouvant dans le secteur en confinement. Je suis reconnaissante envers les personnes de la région d'Edmundston qui s'efforcent de respecter les consignes de santé publique. But with the variant strains, there is a heightened risk of new exposures at any time when people are not following public health directions very, very specifically and precisely. So we can see infections appearing in family members or household members if there's a person who traveled outside the province and if they didn't self-isolate properly. And again, prior to the strains that we're seeing right now, there was a certain level of safety and security around self-isolation happening in your household with other people there and having a separate bathroom, et cetera. But these new infections, these new strains, are so much more contagious that it's very difficult to safely self-isolate in the same household with other people. So we are seeing the spread of the new variants from travel outside New Brunswick, and what that means is that travel is riskier now than ever than any other time during the pandemic. So if you are going to travel, you must be prepared to properly self-isolate away from your loved ones for an entire 2-week period, regardless of if you tested negative when you were at an airport or at a location before you arrived in New Brunswick. You need to still self-isolate. So if you can't do that, then you really shouldn't travel. So it is as simple as that. Je suis heureuse d'annoncer que pour la première fois en plus d'un mois, il n'y a aucun nouveau cas confirmé de COVID-19 à signaler aujourd'hui au Nouveau-Brunswick. Il y a présentement 139 cas actifs de COVID-19 dans la province. Il y a présentement 21 citoyens du Nouveau-Brunswick qui sont hospitalisés en raison de la COVID-19, dont 8 aux soins intensifs. Je vous demande une fois de plus de garder ces concitoyens du Nouveau-Brunswick dans vos pensées et vos prières. Today, I am very pleased to report that we have no new confirmed cases of COVID-19 in New Brunswick, and this is the first time that this has happened in over a month. Again, we've been in a steady state of having several cases, between on average 10. Now we're down to 6 over the last month each day. So now this is the first time that we don't have any. But I still need people to continue to get tested even if you have mild symptoms. There are now 139 active cases of COVID-19 in our province, and there are 21 New Brunswickers who are now in hospital due to COVID-19, including 8 who require intensive care. And I ask again that you keep these New Brunswickers in your thoughts and prayers. Our best weapon against the further spread of COVID-19 is to get as many New Brunswickers vaccinated as quickly as we can. We have now provided 185,548 New Brunswickers with at least 1 vaccine dose. In the last week alone, more than 45,000 New Brunswickers have been vaccinated. And Minister Shephard will have more to say shortly on the progress that our vaccine rollout has had. And we now have spent more than a year on this pandemic journey. And it may seem that the road has never been darker and more treacherous than it is today. We do have some obstacles and challenges, there's no question. But really, when you take into account our situation here in New Brunswick and how very, very different it is compared to our fellow Canadians in Ontario, we are watching that situation with alarm and concern. Le nombre de nouveaux cas signalés en Ontario est plus élevé que jamais tous les jours et son système de soins de santé est poussé à sa limite. Nous ne voulons pas que cette situation se produise ici. Nous ne voulons pas dévier des succès que nous avons connus au cours des 13 derniers mois. It's true that we have all grown weary of the pandemic. Many of us are really challenged by the ongoing public health restrictions, and everyone would really like to have a normal life again, some version of normal. But really and truly, in order to get past these next challenges and hurdles, we all have to buckle down and stay the course for the next several months. We need now more than ever for people to wear masks. We need now more than ever for people to maintain their 2 meters of physical distance from others and continue to wash your hands thoroughly and regularly and keep your number of close contacts extremely low. Nous devons tous rester à la maison quand nous ne sentons pas bien et prendre les mesures nécessaires pour subir un test de dépistage si nous ressentons des symptômes ou savons que nous avons été exposés à une personne ayant contracté le virus responsable de la COVID-19. Et nous devons tous éviter d'effectuer des voyages à l'extérieur de la province dans les mesures possibles. But to do this, we have to continue to do what we have learned over the past year with renewed dedication and determination for a little while longer so we can all be protected here in New Brunswick. Thank you very much.
Good afternoon. Bonjour. Though we are pleased to be able to report no new active cases today, it is important that we all remain vigilant. Overall, the number of new cases of COVID-19 in our province has continued, along with the number of cases caused by the UK and South African variants. As Dr. Russell has said, public health is keeping a watchful eye on what is happening in Zone 4, the Edmundston region. In spite of the measures taken, the number of active cases in that area have not gone down as much as we had hoped they would. I add my voice to Dr. Russell's in asking that everyone do everything within their power to slow the spread of this virus, not just in Zone 4, but across our province. We are seeing how quickly this third wave of COVID is spreading in other provinces, and we do not want to see that happen here. I know that so many of the people who live in Zone 4, the Edmundston region, truly are following the rules and are doing everything right. And I understand that they are tired. They have been under lockdown for more than a week, and things don't seem to be getting any better. Now is not the time to lose hope. Now is the time for compassion and grace for others and for ourselves. We are in this together. What is happening in Zone 4 could happen anywhere in our province because the new variants of COVID-19 are more contagious and they spread more quickly. All it takes is for one of us to let our guard down just a bit. So please, I know you are tired and I know this is hard, but please dig deep and continue to follow the rules. And where possible, go above and beyond to keep one another healthy and safe. This virus does not move on its own, so the less we move, the less opportunity there is for the virus to spread. No travel is permitted in and out of the lockdown area or within the lockdown area except when necessary, such as for vaccinations, medical appointments, work, or to purchase essential goods. Do not travel areas at different alert levels. Do not travel between areas at different alert levels. Follow the directives of public health that apply to the area where you live. It is imperative that we all do so to keep our loved ones and our communities healthy and safe. As you may be aware, Ontario and the federal government have reached out to the Atlantic region for help as Ontario battles the third wave of COVID-19. As Canadians and as New Brunswickers, it is wired into our DNA to want to help. We are seeking individuals who have the necessary skills and are able to go to Ontario to assist with their healthcare efforts. Specifically, Ontario is in need of nurses, respiratory therapists, perfusionists, and anesthesia assistants. While New Brunswick does not have the available resources within the regional health authorities, any healthcare workers who are retired or working outside of the healthcare system are being encouraged to assist. The federal government will cover all expenses involved, including salary, travel, and accommodations. To find out more on how to assist, please contact, capital letters, nbehoc@gnb.ca or call 506-444-2882 or after hours 506-461-2880. This information will also be available through our daily social media posts and through our news release found under the featured news at gnb.ca. Both the social media post and the news release will be posted soon. Our vaccination rollout remains on schedule, and I'm happy to be able to say that we have vaccinated 28% of the New Brunswick population with at least the first dose of the COVID-19 vaccine. I am also pleased to announce that, as of today, people who are 65 and older may now schedule an appointment to receive their first dose of COVID-19 vaccine at a clinic offered by Vitalité or Horizon Health Network, or by contacting a participating pharmacy. To book an appointment at a clinic offered by Horizon Health Network or Vitalité Health Network, you can register online at gnb.ca/bookavaccine or call 1-833-437-1424. There are currently 19,000 spaces available at clinics being offered by Vitalité and Horizon Health Networks over the next 2 weeks. To book an appointment through a pharmacy, check to see if the pharmacy has online booking or call the pharmacy directly. And if you're booking through a pharmacy, please be patient. Many pharmacies have already fully booked for appointments through the next few weeks. If required, a caregiver or individual can book an appointment on behalf of someone who is 65 and over. I encourage everyone who is eligible for a vaccine and wishes to receive one to make an appointment. If you know someone who is eligible to book an appointment and hasn't done so, reach out and make sure they know that they are eligible. And please make sure they are aware that there are appointments available through clinics being hosted by the regional health authorities. If they need help booking an appointment online, please offer to help them. Assisting a relative or friend or neighbor to make an appointment to get vaccinated doesn't just help that person, it helps us move forward as a province. Every day, the percentage of New Brunswickers vaccinated gets a bit higher, edging us closer to a return to normal, but we're not there just yet. I understand how exciting it must be to be finally vaccinated, but please remember that not everyone has received their first dose. For that reason, even if you have received a vaccine, you must continue to follow public health rules, such as wearing a mask in public spaces and maintaining physical distancing. Continuing to follow the rules will help keep everyone in our province safe. Since the beginning of the pandemic, truck drivers have played an important role ensuring items that New Brunswickers need are able to move in and out of our province, which in turn has helped our economy. Truck drivers has been eligible to book an appointment for a vaccine since March 24, and we are making every effort to ensure they have access to vaccination. We appreciate your hard work, and we want to be sure that you are protected so that you can stay healthy. Beginning today, New Brunswick truck drivers who are regular cross-border commuters will have a dedicated line to call for assistance in booking their vaccination. That number is 1-833-724-0088. Agents can assist callers with questions about booking, or they can book the caller right there on the phone. If the caller has to leave a message, they can be assured that an agent will get back to them as soon as possible. The Departments of Health and Justice and Public Safety are working with the Atlantic Provinces Trucking Association to get information about the toll-free line to individual truck drivers. Travel comes with risk, and the vital work that truck drivers do can take them outside of New Brunswick to areas where they have an increased chances of contracting the virus and bringing it back into the province with them. We encourage all truck drivers to book their appointments and to get vaccinated. It is understandable if you are feeling overwhelmed right now. This pandemic has had us all on an emotional roller coaster for more than a year, and too often, everything feels beyond our control. While some things are beyond our control, not everything is. I encourage you to focus on what you can do today to make a difference. Follow the rules and stay healthy and safe. Reach out to family and friends. And if you are eligible, make an appointment to get your COVID-19 vaccine. There is light at the end of this tunnel, and every day brings us a little bit closer. Thank you. Merci.
Merci beaucoup, Minister Shephard and Dr. Russell. Thank you, Minister Shephard and Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question and the quickest follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? Laurel Lyle, CTV.
My question would probably be best for the minister, but I'm wondering if there is a plan in place or in the works to divert vaccines to the northwestern region of the province, to Zone 4?
If Dr. Russell can certainly add anything if I've missed, but we've actually already done that. I think up until last week, we had diverted an additional 3,100 shots, I think, over a period of about 10 days. And we're keeping open our eyes for opportunities to ensure. At this time, I believe the province, Zone 4, is at about a 40% vaccinated level compared to 28% of the province.
Ms. Lyle, do you have a follow-up today?
I do. As was mentioned, we're in day 10 of lockdown for that region, and unfortunately the case numbers aren't in the direction that you'd like to see. What else can be done to get things to start moving into the right direction?
I'll start, and I think Dr. Russell can certainly follow up and add anything. We know how hard this is. This is a testament to how difficult keeping these variants in check is. And just when we think that, we're okay and nobody around me has it and I can, I need to go and do this, and maybe it's not exactly the most important thing in the world, but darn it, I just want to get out for 10 minutes. It's really easy to give in to that. And right now, we need everyone to dig deep and to hold to the absolute necessities. and maintain an extremely small bubble of their one household and continue on and follow public health advice.
I'll just say, Laura, it is true what Minister Shephard says. It is really, really difficult to get ahead of the variants. This is the UK variant. It is more contagious. It does cause more severe symptoms. Having more people vaccinated up there is obviously a great thing at this time. Continuing to follow public health advice is really great. And I think again, any kind of encouragement you can give to your neighbor, your friend, your fellow community members. As Minister Shephard said, if you can help somebody get signed up for a vaccine, if you have friends and family who have mild symptoms, encourage them to get tested. It is the only way to get ahead and stay ahead of these variants.
Thank you. Jean-Philippe Hughes, Radio-Canada.
Oui, première question pour Mme Russell. J'aimerais savoir, est-ce qu'on peut savoir dans quelle zone sanitaire vient la personne qui a fait une thrombose après avoir été vaccinée avec AstraZeneca?
Alors, on n'a pas fourni plus de détails là-dessus maintenant à cause de la confidentialité, parce que c'est une personne et pour identifier la zone, ça serait quelque chose qu'on veut éviter de compromettre la confidentialité.
M. Hughes, as-tu un suivi?
Oui, le Québec aujourd'hui, a diminué l'âge pour la vaccination avec AstraZeneca. L'Ontario, l'Alberta, le Manitoba en ont fait de même. Est-ce que vous songez à permettre la vaccination chez les moins de 55 ans, peut-être dans les zones les plus touchées par la COVID-19 au Nouveau-Brunswick?
Did you want me to start? Sure. OK. Alors, je vais commencer juste pour revenir à l'autre point sur le cas qui a été rapporté sur l'événement avec les caillots. Cette personne avait reçu du traitement. Ils sont récupérés à ce moment-ci. C'est une maladie qui a de traitement. Alors, il y a d'informations sur le site web pour l'Agence de santé publique du Canada et aussi sur le nôtre. Et pour l'AstraZeneca, pour les autres provinces, la situation est différente dans d'autres endroits. Ici, au Nouveau-Brunswick, on va continuer avec notre plan pour donner le vaccin pour les gens 55 et plus. Mais avec de l'information et de l'analyse, on pourrait continuer à utiliser notre propre surveillance et notre propre épidémiologie pour indiquer des endroits ou des populations qu'on aimerait vacciner aussi avec l'AstraZeneca. Mais au fur et à mesure qu'on reçoit plusieurs doses de tous les autres vaccins, on va continuer à utiliser ce qu'on a disponible à ce moment-ci.
Merci, M. Hughes. Thank you.
I will.
Oh.
I will. That's okay. Thank you. I think it's important to note that, I think we've stated that New Brunswick has a lower number of doses of AZ left. They're booked in clinics this week, and they are scheduled to be dispersed. And so I don't believe we're expected to receive any more AZ until well into May, if not the end of May. And so we're just going to keep following this. I think we've seen how information comes on a daily basis through our COVID reality. And so I think that for now, we're going to hold the line and we're going to continue to use it. And for those who are able to book appointments, and they should continue to do so and get the first vaccine that's available to you.
Thank you very much. Travis Fortnum, Global TV.
Hi there. I'm wondering if someone could confirm how much time passed between when this individual got their AstraZeneca shot and when the blood clot was formed.
Well, my understanding is it was sometime in that period of 5 to 21 days, which is the expected amount of time to have that adverse event happen. And as I said, this person was treated and has recovered.
Mr. Fortnum, do you have a follow-up?
Yep, very quick. For Dr. Russell, I think you might have touched on this, but my audio cut out. The outbreak ongoing in the Edmonton region, I'm wondering if you're able to speak to what is making it persist so strongly. Is it the variants?
Well, I think that's the main reason. I think, again, it is much more contagious. It transmits to close contacts before the case themselves have been identified. So that's why, to get ahead of it and stay ahead of it, we have to isolate the contacts of contacts. And we need to make sure that we continue to make sure people get tested, even if they have mild symptoms. And we have to make sure that people keep keep to their one household bubble and continue to follow all public health measures. I think we will see this turn around, but again, it's just taking longer because of the variant. We did have a few cases of community transmission as well. So, but the new cases that we're seeing, I was speaking to one of the epidemiologists today, and the new cases we're seeing are the close contacts, like contacts of people that had tested positive, so they're expected, they were already self-isolating. What we don't want to see is new cases popping up where we have to start the process all over again with respect to contact tracing and isolating contacts of contacts, because it does mean that there will continue to be transmission. So again, we're hoping to nip this in the bud very shortly, as soon as we possibly can, but again, it's a bit difficult to predict how long that'll take, and obviously, we're not looking forward to having any more new travel-related cases with any new outbreaks.
Thank you. Jacques Poitras, CBC.
Good afternoon. There's a video circulating in northwestern Brunswick on social media in which several RCMP and enforcement officers arrive at a gathering, reportedly of about 25 people, and are harangued by one of the people there for about 5 minutes, and then they leave without taking the names of the people at this gathering. And I'm wondering what that says about the enforcement levels when we see these stubbornly consistent case rates in Zone 4.
I'll take a stab at that. We're trying really hard not to use the iron fist. But the fact is we do need our partners at public safety to keep us aware of what's happening and to understand if we need to do anything to mitigate individuals' behavior. And so all I can say, and I have to admit, Jacques, I have not seen the video. I'm barely aware of it. Just as you were speaking about it, I think I had heard something about it. So I can't speak to it, purposefully to understand the whole situation. But it is my hope that with our public safety partners, we would be addressing serious situations like that. And we'll go back and get some information on it.
Thank you. Mr. Poitras, do you have a follow-up today?
Yeah, I see that in Ottawa, the NACI announcement on updating AstraZeneca guidance was canceled, and people there are talking about the New Brunswick blood clot case. Dr. Russell, was it put off because of this case, leading them to look at things again?
No, actually. In fact, we're not the only province that has had some adverse events, including VIT. Other provinces have had some, and we'll continue to investigate any events that we have. It wasn't related.
Thank you, Mr. Poitras. Andrew Waugh, Brunswick News.
Yeah, this is for either the Minister or Dr. Russell. Any concerns that this blood clot case, as rare as it is, might lead to some more vaccine hesitancy, specifically regarding AZ?
Well, Andrew, I'm going to start, and if Minister Shephard wants to add, certainly, again, there's a double-edged sword with transparency information, is the interpretation and perception. So as the scientists and specialists and advisory folks do their work, as Health Canada does their work, and Special Advisory Committee and Public Health Agency of Canada, we're all working hard to make sure that vaccines are safe and effective and are given appropriately to the right population at the right time. When the signal popped up that, yes, you can see these issues in the UK data and the European data, we are seeing a few reported cases here. I guess we want people to be confident in the fact that that the information has been looked into and analyzed, and that we are pivoting and shifting our approach and our advice based on all of that on a daily basis, on a weekly basis. As Minister Shephard said, that the information changes week to week. In terms of vaccine hesitancy, obviously, if the information is presented in a way that people can understand the fact that the risks of COVID-19 right now in certain situations, obviously, if you're living in a very, very high case count area, it's very clear that whatever vaccine you're offered is the vaccine that you should take, because the risk of getting COVID is high and the risk of having a bad outcome from COVID is very high. With the AstraZeneca issue, we've seen the reports as 1 in 100,000 doses of the vaccine to 1 in 250,000 doses of the vaccine. And I know that everybody who's gotten a vaccine knows that there's epinephrine on standby in all the areas, because we know that anaphylaxis can happen with any of the vaccines. So in terms of vaccine hesitancy, all I can say is that I do hope that the transparency and the way that the information is presented will allow people to make informed decisions and informed consent about the risks and benefits of getting vaccinated. And right now, based on the variants of concern, the vaccines that we are offering, obviously from an efficacy perspective, from preventing hospitalization, ICU admission, and death, are all very, very effective. And as you know, our goal from the outset of the pandemic has been to avoid hospitalization, ICU admissions, and deaths.
Thank you. Mr. Wald, you have a quick follow-up.
I do. Dr. Russell, you made quite a few comments there at the start about travel, and, people being, still traveling in more cases. Like, do you think we should be doing more to curb travel in and out of New Brunswick?
Just coming back to the other issue around the adverse events, in the cases here in Canada, when they get reported, they do get investigated, but based on the information that we have in terms of the treatment options, the adverse events are treatable, with respect to VITT. So coming to the travel issue, Andrew, the issue around travel, the Atlantic provinces have had these travel restrictions in place from early on in the pandemic. There weren't a lot of places that had travel restrictions other than places like New Zealand and Australia, and some other countries. So we know from the outset of the pandemic that travel restrictions work extremely well. In the face of the variants, it's more challenging, because it takes a more concerted effort to make sure that people are self-isolating appropriately and safely, and that's harder with the variants of concern because they're so much more contagious. So we are recommending that people should not travel unless it's absolutely necessary, period. I don't know that we could actually restrict travel more than we already have. We do need essential goods to come across our borders. Again, there are a certain amount of limitations that we have right now in terms of people's requirements for self-isolation, et cetera, and even testing requirements. I think there is a false sense of security when people get tested in the location that they're at prior to arriving in New Brunswick. Regardless of a negative test, you can become positive at any time during the 14 days after you arrive in New Brunswick. So everybody needs to self-isolate for 14 days after arriving here, because it's really critical at this time to prevent the transmission of the variants of concern, including the UK variant, including the South African variant, and there are other variants of concern that are emerging all the time.
Thank you. Gilles Duval, TVA.
Oui, bonjour, vous m'entendez?
Oui.
OK, d'accord. Ce serait pour savoir, demander à Dr. Russell, est-ce qu'il y a eu on sait qu'il y a eu beaucoup de vaccinations au cours des derniers jours ici dans la région du Nord-Ouest. Est-ce qu'il y a eu un bon pourcentage d'utilisation des vaccins, dans le sens, est-ce que toutes les cases horaires ont été remplies, ou encore est-ce qu'il y a des gens qui se sont inscrits mais ne se sont pas présentés, par exemple, pour la vaccination? Donc, est-ce qu'il y a des vaccins qui ont été perdus, en quelque sorte?
Moi, j'ai pas entendu qu'il y avait pas des gens qui avaient inscrit puis qui n'avaient pas été pour leur vaccin. J'ai pas entendu qu'il y a des vaccins qui n'ont pas été utilisés.
C'est une autre question, M. Duval?
Oui, je voudrais savoir où on est rendu avec ce qu'on appelait l'éclosion au foyer Saint-Jacques, et peut-être en même temps nous dire s'il y a une éclosion due à un nouveau variant. Est-ce qu'on croit que c'est plus long de combattre l'éclosion que ce qu'on appelait la COVID au début, là?
Oui, je crois que oui. Au sujet de si les éclosions avec les variants sont plus difficiles à gérer, la réponse de cette question est oui, mais on n'a pas de nouveaux cas à ce moment-ci.
Merci, M. Duval. Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour. Ma question est pour la Dr. Russell. Je voulais savoir si vous avez une meilleure idée maintenant de quel vaccin vous allez donner aux personnes de moins de 55 ans qui ont déjà eu une première dose du vaccin d'AstraZeneca. Je sais que un peu de passé, vous avez dit que vous ne saviez pas encore. J'aimerais savoir si vous avez eu plus de données ou s'il y a un consensus au niveau national par rapport à ça.
Vous voulez savoir combien de gens ont eu une dose de AstraZeneca qui était en dessous l'âge de 55?
Non, je voulais savoir si vous savez quelle deuxième dose vous allez donner aux personnes en dessous de 55 ans qui ont déjà reçu une première dose d'AstraZeneca.
À ce moment-ci, non, mais on attend pour d'autres informations, d'autres données, parce qu'ils font des recherches au Royaume-Uni maintenant pour voir quels sont les résultats quand on donne deux différentes doses de deux différents vaccins, un après l'autre.
M. Boudreau, as-tu un suivi?
Oui, pour la ministre Shephard, je voulais juste avoir une clarification. Est-ce que l'idée d'envoyer des vaccins en Ontario est complètement hors de question?
So right now, Ontario's request for assistance with regards to human resources is being put through a process, and we put out a call for that. But with regards to more vaccines, I think at this time, the federal government is leaving things the way they are, and I think that we'll just keep an eye on things in the future. We have a hot zone in our north, which we've redirected some of our vaccine supply to, and have gotten them 12% higher numbers of people vaccinated in our north than in our the rest of the province, in our zone 4. So we're still watching that.
Thank you. Vicky Hogarth, CHCO-TV.
Thank you, Bruce. My question is for Dr. Russell. The New Brunswicker who developed blood clots from AstraZeneca, what were the symptoms and the severity of the reaction, and what is the treatment?
So I can't really give too many details on the situation other than they did meet the criteria for that particular adverse event. And there are certain tests that have to be done. And in terms of the treatment, the presentation is similar to a heparin-induced thrombocytopenic thrombosis, but the treatment is non-heparin anticoagulants. So that list of treatment options is on the Public Health Agency of Canada website. And again, when we look at the fact that it could happen between day 5 and day 21 of after somebody has received AstraZeneca, again, 1 in 100,000 or 1 in 250,000 doses. When people are aware and clinicians are aware of the issues and the diagnosis and the capability of diagnosing and treating, again, what we're hearing now is, yes, it can happen, and it's recognizable and identifiable, and there's a treatment, and that's a good thing.
Ms. Hogarth, do you have a quick follow-up?
I do. Thank you, Dr. Russell. My follow-up is for Minister Shephard. Is there talk of delaying the Atlantic bubble reopening till further later in May?
I believe that there was a call with the premiers today, and there is some consideration of choosing a date further out, but the date has not yet been decided.
Thank you. Marie Sutherland, CBC.
Good afternoon. My question's for Dr. Russell. I noticed that on the province's dashboard that the Edmundston region has the lowest compliance with operational plans of all the zones at 82%. What kind of non-compliance are you seeing, and what's being done to correct it?
I think I'll take that one. We have been in touch with public safety and having those conversations, and on the surface, we're seeing very good compliance. I think that all we can do is continue to monitor and continue to drop in. We're not beyond issuing fines to businesses that are non-compliant if they have been warned and worked with in the past. But we're trying to be very educational about this and trying to be collaborative so that we can support everyone during this very difficult time. The most important message is that we have to follow public health advice, and we need to stick to our one household bubble.
Ms. Sullivan, do you have a follow-up?
I do, thanks. Dr. Russell, I have a question regarding a cluster of cases of the unknown neurological disease. I'm wondering if you can tell us why there have not been any information sessions in the affected areas yet, and if you have a date when the website is expected to go live.
I'm going to let Minister Shephard take that one.
Yep, so the Secretariat at the CJDSS is certainly working on the website, and it is expected to go live any day. We know that this mysterious illness creates a lot of anxiety, and we certainly want to have as much information that is available to the public. As for specific briefings in each area, I don't have a date for you on that, and I guess I will ask, of our public health department as to what is being, what requests have come in, and what information we would have to convey that, I guess that would help to lower the stress. So at this time, we don't have a date.
Thank you, Ms. Sullivan. Mouvement Tambour, Radio-Canada. Jean McKinnon, CBC.
Yes, thank you. Minister Shephard, with today's announcement that people who are 65 and older can now book appointments for their shots, how quickly are you expecting these next age brackets to move, given that a lot of people 55 and older have already received their AstraZeneca shots?
Well, it's really yet to be seen. These appointments can fill up quite quickly I know that the phones start ringing from the time we announce it at this press conference. So I'm expecting the same type of reaction today. We're getting into our largest demographic group. So I think, again, I can only point to the fact that we want to have everyone vaccinated by the end of June. And so I'm going to suspect this age group is going to take, a few weeks to comb through.
Do you have a follow-up, Ms. McKinnon?
Yes, I do. Thank you. Dr. Russell, since travel is riskier, what is the ideal way to self-isolate now? And will the province change its self-isolation recommendations to require people to self-isolate in a different household or for a longer amount of time or some other kind of changes?
Well, my understanding is the mandatory order already has in it that if you cannot safely self-isolate in your own household, that you should not self-isolate in your household. And throughout the pandemic, there has always been the option of reaching out to, I believe it's the Red Cross through JPS, in terms of being able to have different accommodations. So in terms of the variants of concern and the risks of self-isolation in a household with other people, it is riskier now than it has been because of how contagious the variants are. If you can self-isolate outside of the household, then that is the safest thing to do. If you are self-isolating, the information that we have on our website, I think, is still accurate in terms of not sharing a bathroom, not sharing utensils, staying in a different room the entire time. Again, it is much riskier because the contagiousness and the transmission of the new variants of concern are, again, so much greater.
Nathan DeLong, Miramichi Leader.
Good afternoon. My question is for Dr. Russell. The superintendent of Anglophone North School District has alluded to a return of more traditional graduation ceremonies being possible this year. Of course, that's pending COVID protocols at the district and facility level and depends on how the guidelines of the province might look at that time. So I was wondering what your response is to that idea.
I'm going to take that one. So all of these kind of activities, are vetted through EECD and public health. They work together, public safety even, to try to understand what our status is going to be at any one time. And right now, I don't think we can predict beyond a couple of weeks at this time frame. So I think it would be premature to judge that we could go to any kind of a judgment on what could be, by mid-June. So I think that it will be evaluated on an ongoing basis, and decisions will be made at the soonest possibility.
Do you have a follow-up, Mr. DeLong?
Yes, I do. Definitely see what you're saying about the situation changing quickly and it being hard to predict. I just was wondering if the province has any plans to issue guidelines for graduation events specifically.
I'm sure EECD is working on that, and we can try to get you an answer to see if, no doubt, I'm sure there will be guidelines if graduation ceremonies are able to proceed, but I don't want to anticipate what that would be.
Thank you. Meg Cunningham,
Thank you.
CHNA, Sackville.
Thank you, Bruce. Minister Shephard, people protested along the Nova Scotia and New Brunswick border on Sunday. Some saying the continued closure is doing damage to their families so that they can't access their support systems that are just 10 minutes away. How do you respond to what those protesters are saying?
COVID has been a very difficult time. And whether that service is 10 minutes away or 1 hour away, we have public health guidelines that are put in place to keep New Brunswickers safe. Our border measures have served us very well over this last year. With the variant, it is even more so. I've commented to not only my colleagues, but people in the public, that this last stretch is probably the hardest we've ever gone through, because we see that light at the end of the tunnel. We see how close we are, but we're also extremely vulnerable. And you can look across Canada to see how this third wave easily gets out of control. The measures are in place for a reason.
Thank you.
That concludes today's COVID-19 update for New Brunswick with Dr. Russell and Minister Shephard. Just for a quick recap of everything we heard today, there were no new cases in the province today, which is a huge milestone given the outbreak that has been going on in Zone 4. So we're down to 139 active cases in the province from being 158 yesterday. Now, other new news we heard today. People aged 65 and up in New Brunswick are now eligible to book an appointment either at a pharmacy or through one of the health authorities. Dr. Russell, in a question I asked based on questions that came from viewers on our Facebook live chat, we're wondering about the Atlantic bubble reopening. Obviously, the Premier of Nova Scotia earlier today had mentioned he thinks that it should be delayed further than the recently rescheduled May 3rd opening date, and Minister Shephard did confirm that it will likely be later in May that the Atlantic bubble reopening will be scheduled, but there's no date specifically set yet. Now, I've just posted some information on our Facebook page. I would recommend checking it out there in terms of a call for retired healthcare workers, in particular from New Brunswick, who might be interested in volunteering to go to Ontario to help out with the COVID-19 crisis that's currently taking place there. All expenses will be covered, I do believe, by the federal government, and a salary, but the information is on our Facebook page, and as well as the contact information to where to go if you qualify and do want to help out. Again, there was also a case of a rare blood clot in New Brunswick, a person aged 30 to 39 who received the AstraZeneca vaccine earlier this year, before the regulations have changed to make it for people 55 and up. We will be reporting on that later today in our news report tonight, and I look forward to sharing that with you on Facebook as well. I'm Vicki Hogarth from the CHCO News Desk. I'll see you next time.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.